All right, a big thanks to RG Bank. They bring us our news on this beautiful Friday morning. Good morning, Pagosa, and TGIF and all that. We're actually over here at the hospital this morning, and I'm here with Jodi Scarpa, Manager of Community Relations and the Foundation. Also, Amber is here, but Jodi will introduce Amber. Amber Manwaring, the Compliance and Privacy Officer. There we go. Nice to see you guys.
Hey, Will.
Welcome to the radio again, Jodi, and nice to meet you, Amber.
Thank you. Hey, Will. Thanks for hosting us today.
Yeah.
I am usually here to talk about the PSMC Foundation and our community outreach, but today I brought Amber with me, our Director of Compliance and Privacy and Quality, to talk about important patient issues of patient privacy, patient concerns, and the related structure for both. But first, I want to give a quick update of all things PSMC.
Cool.
Our medical wellness building, that cool white building on the corner of 160 and South Pagosa, we're waiting on approval from Medicare to open. And so the building is finished. We have staff ready to go to start physical therapy, but we're just waiting on that confirmation from Medicare. As soon as we know that we're able to start, we will plan a community open house and invite the public in to see it. You would not recognize it, Will. Oh, yes.
Yeah, I can tell just from the outside.
Yeah, it's beautiful, isn't
it?
And lit up. I like it. We hired Dr. Jose Corral. He will be our new neurologist in addition to Dr. Bentley, and he will be starting March 1st. And our critical care pulmonologist, Dr. Barry Holcomb, I think you interviewed him, didn't you, Will?
Mm-hmm. Sure did.
Sure did.
A couple of months ago. Yep.
We now have the pulmonary functioning testing machine, the PFT machine, so all of the lung care you would need for him, you can get right here at home, close to where you live. We're seeing an unhappy note. We're seeing a lot of respiratory illness in Pagosa right now. I want to say, remember to wash your hands. RSV is at the highest it's been in 7 or 8 years, and also you can use hand sanitizer. So put some in your car, Amber?
Yes. Right. It's a good idea. Yeah, whatever's going around is nasty.
And also, I want to say to the listeners that PSMC has been working hard, collaborating with CDOT. I don't know if everyone's heard, but CDOT is going to work on the 160 downtown, and we're working closely with them to make sure that patients who need EMS can get here as quickly as possible. So there's not just by our EMS chief, Jason Webb, working with them, but all the other first responding entities are working closely with CDOT. So there is a plan out there for that, but we're anticipating some maybe slower times. And I just want
that starts soon. I know they're staging downtown, and I think in a couple of weeks they'll be underway.
Yes.
Here we go.
Well, I'm going to ask Amber some questions. Amber, I want to say thank you for coming to help us understand how PSMC approaches our privacy and concerns. And can you tell us how we handle concerns?
Yes, I can. Thank you, Jodi. I'm excited to talk about this because reporting concerns is one of the best ways that we can improve patient care and workplace safety, and to ensure that we're in compliance with all applicable rules and regulations. Some examples of reportable concerns would be medical records being left out in the open, patient safety issues, workplace safety hazards like wet floors, or even suspicious billing practices.
So let's start with the basics. I know we have a speak-up culture here at PSMC. What does that mean?
A speak-up culture means creating an environment where employees, patients, and even visitors feel comfortable reporting concerns without any fear of retaliation. It's about making sure that everyone's voice matters when it comes to improving care. Some of the basics are, if you see something, say something. Reporting concerns helps prevent harm to patients and staff. Reporters can be anonymous, so reporting allows anyone to report concerns without revealing your identity if you'd like to keep that anonymous. And most importantly, no retaliation for reporting. So employees and community members are protected from punishment for raising concerns, and in fact, we celebrate it.
So when employees have a concern and they come to you or our patients, they come in and they report it. Do other people in the organization find out about it, that where everybody knows about it, or is it is strictly confidential?
It is strictly confidential. That's exactly right.
So we're encouraging people to say something if they see something that isn't right.
That's right, exactly. We want people to feel empowered to report concerns, so we have an opportunity to address them quickly. Just remember that reporting leads to improvements, and it helps create a safer hospital.
Okay, let's say someone sees something concerning at the hospital, like see these a wet floor, medical records sitting out. How would they report that?
Great question. Here at PSMC, anyone, employees, patient, visitors, can call the quality coordinator at 970-507-3824 or email quality@psmedicalcenter.org and request an immediate consultation. If the quality coordinator is not immediately available, if they're already with someone else or in a meeting, you can leave a message that includes the patient or patient representative's name and preferred contact information, and the quality coordinator will contact them and thank them for sharing their concern. And also, if you have any billing questions, you can call billing at 970-585-2405, or a general number is 970-731-3700. Every report helps us shine a light on concerns and develop plans for continuous improvement.
So if a patient were to walk in the front of the building and say to whatever PSMC staff member they found that they had a concern, could any PSMC staff member take the concern?
Yes, they can, and they can enter it into our reporting software, and that will route to us.
Well, let's talk about patient privacy and start with the basics. What does a privacy officer do at the hospital? And this is a big area of interest because we live in a very small town.
Yeah. Mm-hmm. Absolutely. Great question. My job as privacy officer for the hospital is to make sure that all patient information stays confidential and secure. That means training staff on privacy laws, ensuring that PSMC follows federal regulations like HIPAA, understanding how other agencies' privacy laws may or may not interact with HIPAA, and helping patients understand their rights when it comes to their medical records. Some of the basics of HIPAA to know are your health information is private. PSMC must protect your personal medical records. You control who sees your information. Your records can be shared if you give permission or if HIPAA gives permission only. You have the right to access your records. Access is a big part of it as well. Patients can request copies of their medical records and request corrections for any mistakes. PSMC cannot share your information, so doctors, nurses, and employees at PSMC cannot discuss your health information with anyone unless it's authorized. And staff cannot share patient details or photos, even without names, on social media.
What does HIPAA stand for again? I should probably know that. But.
Health Information Portability and Accountability Act.
Okay.
And that's the federal law, right?
Yes, that's correct.
Uh-huh.
So let's talk about real-life situations. One thing I hear is a lot of people wondering if their family members can see their medical records. So can a spouse, parent, or even a close friend access someone's health information if it's not part of their job here at PSMC? Like, can anyone who works at PSMC look up patients?
That's a very common question, and the short answer is no. Unless a patient gives written permission for a release of information, we can't be releasing information, and no one should be accessing records without an authorization or a business need to know. There are some exceptions, such as an emergency, written into the law, but generally your information is kept private per the law.
So, so people who come into PSMC can have confidence that whatever we see or know or do is private?
Absolutely.
That's good to know.
Yeah, it is.
Yeah. What about phone calls? Let's say someone calls the hospital asking about a loved one. Can PSMC tell them anything?
Great question. It depends. If a patient has agreed to share that basic information, it's called registry level information, we can confirm if they're admitted and their general condition, like stable or critical. But we can't give details about the treatment that they're receiving unless the patient has given us that permission.
That makes sense. What about something like social media? Can hospital staff talk about patients on their personal accounts?
Absolutely not. Even if they don't mention their name, sharing any identifiable patient details online is a potential HIPAA violation. Our staff is trained very well on this, and they take it very seriously.
Could you tell the listeners what's identifiable information?
Yeah, there are a lot of different elements that could go into that. Generally speaking, it has to be 2 or more pieces of information. Some examples would be your name and your date of birth. The more information, the closer it gets to identifying who the person actually is. And HIPAA has 18 different elements that are named as PHI.
Could just a situation be identifiable information? Like if there's only one helicopter crash here over the weekend, would that be identifiable? If there were 3 victims and only one of them was a woman and we talked about it, could that be identifiable information? Or someone had a specific kind of car, or if you could use it to identify people, would that be identifiable?
Potentially, yes. Once you start adding in more and more details to an event that could identify who you're talking about, you step closer and closer to that. So absolutely, yes, could be.
Makes sense.
Let's say someone wants a copy of their medical records. How do they get them?
Great questions. Patients have the right to access their medical records. That's an important piece of HIPAA as well. At PSMC, they can request records by filling out a simple form at our HIM, that's Health Information Management Office, and by law, we must provide these records within 30 days, but we usually get them out much sooner than that.
And so you can just walk into the front of the building and go straight to medical records. You don't need an appointment. You can just go request them right there.
Correct.
And I know we have them online, too, on
Yes.
our website.
That's right.
Well, let's do a quick lightning round, and I'll throw out some privacy-related questions, and you tell me if it's allowed or not. Buckle up, Will.
Okay, I'm
Here we
buckled.
go.
Okay, listeners, hang in there.
Let's do it.
Okay. Can a doctor discuss a patient's condition with the patient's employer?
No, not without written consent from the patient.
Okay. Can a hospital refuse to give a patient their own medical records?
No, patients have the right to access their records unless there's a legal reason to block the sharing of that information. An example would be having a mental health concern where releasing the records could cause harm.
Can someone take a photo of a patient in the hospital without permission?
No, absolutely not. Taking or sharing photos of a patient without their consent is a serious privacy violation.
Does HIPAA apply to everyone? For instance, and I'm making this up, if my friend's daughter has cancer and he told, my friend's daughter has cancer and her father told his friend who works at City Market, Is that a HIPAA violation?
No, not necessarily. HIPAA only applies to covered entities. An example of a covered entity would be an organization like PSMC, a hospital or something like that would fall under covered entity. It does not apply to a member of the community that isn't working for a covered entity, as an example.
Well, talking about HIPAA, I have a HIPAA joke. Do you want to hear it?
Sure do.
Knock, knock, Will.
Who's there?
HIPAA.
HIPAA who?
Can't tell you.
Oh.
Get it?
Oh, very good, Jodi. Yes, I get it.
Okay. I have one last question. Can a patient ask for their medical records to be corrected if they think there's a mistake?
Yes, absolutely. If there's an error, a patient can request an amendment, and the hospital must review it and make a determination.
Thank you, Amber. That's really helpful. Do you have any final advice for our listeners?
I'd say just remember you have the right to privacy and access to your medical information.
Thank you.
Mm-hmm. Thank you, guys. Hey, let's just take a quick break. I want to get back and just talk about what we were talking about in the very beginning, too, with the highway construction and all that.
Okay, thank you.
So hang in there. We'll be right back, folks. Stay tuned. Okay, we're back. Good Morning Pagosa continues here at the Pagosa Springs Medical Center. And it's Friday. Wonderful place here. I encourage you to get some primary care here. Give them a call. Go to the clinic. They do a wonderful job. They always solve problems. And you can call 970-731-3700. But Jodi, do you want to go over some of that CDOT stuff again? As far as, we're getting ready for some construction downtown, and
we are.
There could be delays, but you're working with CDOT and all that.
We're working with CDOT. Dr. Rhonda Webb, our CEO and chief, our EMS chief, Jason Webb, are working with different organizations in the community and in conjunction with CDOT to ensure that we can get to patients as quickly and safely as possible using that corridor or plans to go around it. It's one of the great things about Pagosa Springs in our community is that we can be challenged, but we get together to do our best to mitigate any potential issues. Right. But there will likely be delays. I mean, if you think about the 4th of July and how crowded it is on it in general, how is that going to work? And I know the town is working on their 4th of July plans.
Right.
And I think, too, about how it affects. So every summer we have the gala that Rhonda talks about downtown, and that might affect how fast people can get to it and how they leave. And so our visitors.
This is for the foundation.
For the foundation.
Yeah, we'll hear more about that. Looking forward to
Archuleta County Fair for our Tough Enough to Wear Pink Rodeo in August. And parking, it's all in front of us, but I think it might not be solvable, but we can make it better.
Oh, yeah. Yes. All right. Well, thanks, Jodi. Jodi Scarpa, Manager of Community Relations and the Foundation here at PSMC. Amber Manwaring, Compliance and Privacy Officer. Thanks for that information on our right to privacy and all that. And do you have anything else to say, or you're good? Okay.
I do.
Thanks.
Don't say anything. Don't tell. Don't talk about it. Shh.
It's a secret. No pagossip.
No pagossip here. No.
Well, thank you guys. Really appreciate you having me here at the hospital today, and have a great weekend.
You
we'll
too.
See y'all later.
Thank you.
Okay. Thank you. Bye.
Bye.